Today, I will be talking about a little overview, but this audience doesn't need much, but about CHIP and the MPN, but really the associated cardiovascular risks. And so I had talked to the patients yesterday at our patient symposium, but that the CHIP and MPN associated with increased risk for coronary artery disease, arrhythmias, congestive heart failure. So we'll talk a little bit about the mechanism of that and what's known. And then I move on and I'll be talking about what's in the guidelines. How should we be treating these patients when they come into our clinics and the oncologist clinic with CHIP and with MPN? And really, spoiler, there are no guidelines that tell us what we should be doing for these patients. There's some vague recommendations from the NCCN that we should be assessing and addressing cardiovascular risk factors, smoking, but not really any strict how-to, where I think we do really well in cardiology and in oncology following guidelines. And so I'll be walking the audience through my approach as a cardiologist and what I'd recommend we could do using a mnemonic, the ABCDEs, talking about how to identify and optimize cardiovascular risk factors and decrease risk for cardiovascular events for these patients who are at high risk. I'll also be talking about some really interesting thoughts about the mechanism as to why these patients are at increased cardiovascular risk and how we potentially may need to think about treating them a little bit differently than traditional patients with coronary artery disease or other cardiac issues.